Staffing shortages and a lack of funding continue to be issues for emergency medical professionals around Pennsylvania.
Today at the state capitol in Harrisburg, EMS professionals from across the Commonwealth have been calling for legislative action. And tonight, our state capitol correspondent Brendan Scanlon is joining us live to tell us more about, Brendan, the current challenges for EMS agencies and what they face. Good evening.
Good evening, Mike and Eva. And yeah, Eva, that's exactly right. So in 2021, Pennsylvania's EMS system consisted of about 1,200 different agencies that responded to nearly 2.5 million calls for service, an average of about 6,700 calls per day. Now, though we're usually the ones calling on them when we need help, today they were calling on the General Assembly for some much needed relief.
EMS is in crisis.
EMS services are in peril.
These financial struggles have become dire.
EMS professionals are sounding the alarm. Many agencies around the state now just hanging on by a thread.
Are on the brink, just months, weeks, or even days from insolvency.
The clock is ticking as expenses are increasing and the stakes could not be higher.
To ensure that we can fund emergency medical services in the Commonwealth, or people are going to lose their lives.
Rising costs for fuel, staff retention, and equipment paired with a low Medicaid reimbursement rate are making it harder for first responders to answer the call.
Ambulance providers receive below-cost reimbursement for 70% of all transports.
Past president of the Ambulance Association of Pennsylvania, Barry Albertson, says the funding model for EMS is inadequate and now unsustainable.
Since 2002, after implementation of the Medicare ambulance fee schedule, costs have risen 70%, while reimbursement rates have risen only 27%.
We have to continue to increase this reimbursement rate because it's vitally important for our EMS providers.
Representative Martin Causer is the sponsor of House Bill 2434. His bill would raise the Medicaid reimbursement rate for EMS providers, especially in rural areas.
I am truly worried about this crisis and the lives that could be lost if we don't act now.
Lawmakers say it's a bipartisan issue that both the House and Senate need to act on fast.
And I don't want to say that it's critical because it's at a breaking point right now.
And at today's event, we heard about several different bills that are in the works that span from increasing that Medicaid reimbursement rate all the way to finding new revenue streams for these different agencies and even shifting EMS personnel across state lines in times of crisis. We'll have more information on this event today for different EMS agencies up on our website, erienewsnow.com. But for now, live inside the state capitol for Erie News Now, I'm Brendan Scanlon.